Welcome to the Medical Manners Podcast, where I give healthcare providers simple tips for ways they can transform the way they connect with their patients and colleagues. Connecting with patients isn't some secret sauce that some of us have and others don't. They're just skills, implemented consistently over time. If you want to transform your medical practice, you're in the right place. I'm Katie Wyatt, your host. This episode is sponsored by the Connect Better audio course. This course is for healthcare providers who want to drastically improve their patient satisfaction or Press Ganey scores. Each week for 6 weeks, you will listen to a 5 to 10 minute audio training. Then throughout the week, your job is to implement the skills you're taught in every patient encounter. You'll be amazed at how much your score can improve in such a short amount of time. Go to medicalmanners.com and use the code PODCAST for 10% off the course. Today's podcast episode is an interview with me and Liz Florentino. And Liz reached out to me. She had an experience a couple years ago where she felt that she had experienced some medical malpractice. And she pursued a lawsuit and wanted to talk about that experience, what made her want to pursue a medical malpractice lawsuit claim, and her experience through that. So I preface this conversation by the fact that I am not a lawyer. I have no law training, but I do think it's important for medical providers to hear from someone who wanted to sue a medical provider. It's important for us to hear why they wanted to do it and what's important to them as a patient in this process. So I hope that you can understand where this conversation comes from and that we can learn from it and try to do and be a little bit better. Liz, welcome to the podcast. I am grateful to have you here with me today. Why don't you go ahead and tell us a little bit about yourself? Tell us about your story.
Before all this happened, and when I say all this, I'm talking about my malpractice experience. I was a baker, and I worked for local restaurants for many years, and then I had my own little bakery. And so I had a home bakery during this time when I fell and broke my elbow. I had a terrible triad injury, and so I needed surgery. I was sent to a specialist. The surgery went okay, seemed to go well. I had an occupational therapist that I saw every 2 weeks for 3 months, and I was supposed to go see the surgeon for follow-ups every month. So I went for my first month follow-up, and everything seemed fine. I wasn't told otherwise. I was just healing from a broken elbow and working on getting strength and mobility again. And when I went in, he, without warning, without explanation, did a series of moves on me that were explained to me later on by another surgeon that sounded as if he was performing some messed up version of MUA, manipulation under anesthesia.
But you were not under anesthesia.
I was not under anesthesia.
Okay.
And I wasn't told what was happening. So he grabbed me in a series of 3 blows, and I cried out for him to stop because he was hurting me. He didn't stop. And he didn't explain what he did. He told me that we're going to see what you're made of.
Okay.
And he said, no pain, no gain. Also, no pain, no gain. We're going to see what you're made of. And, people might wonder, why didn't I question him about what had happened? I was definitely in shock looking back. It became very clear by the next morning that what he did was very much not right. I was really hurt by the next morning, and the injuries started really taking shape throughout my entire body, head to toe injuries. So that was the beginning of my medical malpractice nightmare. And I started reporting to the hospital what had happened. I reported all up and down the ladder with the hospital and was referred over and over again to one man who was the risk management director. And I wasn't at the time, I didn't even know what that meant. That's where you go if you're going to sue. And I was looking for help, and I was looking for someone to tell me that the surgeon wasn't going to hurt someone else.
Right.
I was really concerned about that. I could picture him hurting an elderly person or a child or anyone else. And he did, in fact, hurt someone after me that I know of. And so it's possible that he's hurt even more people than that.
And Liz, let me ask you real quick. When you said head to toe injuries, were the manipulations he did full body manipulations? Or it was...
They were not. Actually, they were just my arm, but he would use so much force that it torqued my body, and I picture a wrung out dish towel
Yeah.
where I'm still getting straightened out 4 years later. But the bulk of my getting straightened out was over the course of a couple of years and about 150 different appointments with doctors and physical therapists and various other medical doctors and mental health clinic also. So I was indeed truly hurt.
Yeah.
I was disabled. I couldn't work. I lost my home. I lost my mind to the injustice of it. I lost. So when you're hurt like that by someone that you trust and you're so vulnerable, there's just so much trauma that occurs from that. And I kept reliving it over and over also.
Mhm.
Every aspect of my life was affected by what he did to me in those couple of minutes. And he works for a major hospital corporation, and I started reporting to them. It took me months and months and months to compile a complaint that I was told to turn in. They said, "File a complaint." And by the time I did, nobody really read it,
Hmm.
and I was told that he was working within his scope of work. So they were lying. They just ignored me and did not help me. That's a really long story. I actually wrote a book about my experience. It's called Angels, Bullies, and Brick Walls. And that's one of the brick wall systems that I refer to, is that I could not penetrate the hospital system.
Gotcha. You wanted what was done to be known, and you wanted to make sure it didn't happen again. Like you said, originally you weren't thinking, I'm going to sue. That wasn't your thought. You were just thinking wrong was done and someone needs to know so it doesn't keep happening. Am I getting that right?
Yes, that's just right. And I actually had faith in the hospital that they were going to help me. For about 10 months, called different offices trying to find the right person who could help me and take this man seriously to make sure that he wasn't going to hurt someone else. And there just wasn't that person. That did not exist throughout the entire hospital system. They just referred you right back to the risk management director, one person. And I reported all the way up to the president of this hospital and their leadership team, and they were absolutely silent and sent me right back to the risk management director.
Hmm.
So in the meantime, I'm, going to many, many appointments to get straightened out while I'm trying to report this. And when I found out that they weren't going to help me, by that point, I found out that I had no legal rights either, that my rights had been watered down so much by tort reform that no lawyer would take my case. In
Hmm.
Ohio, we have a statute of limitations of just 1 year for most cases. And in my situation, if I had won a case, it would have been capped at $250,000, which with that money, it just wasn't enough to get there and pay the lawyer fees and the court costs out of that. So no lawyer could take my case, and I was left to deal with it on my own.
Hmm.
So like I said, I couldn't work. I lost my home. I lost my mind. And I went on to protest the hospital in order to try to save myself because I was so deep into the despair of it, into the injustice that I couldn't handle it.
Mm-hmm.
Obviously, I survived it. I'm not against the medical community at all. I had the best doctors, the best care. No other doctors could have done what these doctors did to help me, I don't believe.
So you found a good team now that's been able to help you rehabilitate and get back
Yes.
so you can be on your feet.
Yes. So I just have some minor issues with it physically.
Mm-hmm.
And emotionally, I've worked through a whole lot of stuff. It's creeps up on me now and then.
Yeah.
And there are signs with me every day, all day, of where I'm at in life because of what he did to me. I'm still in the apartment that I had to move out of my house to go to, and I'm still trying to find a job in a different way because I can't do restaurant work anymore, or that kind of work that I used to do.
Mm-hmm.
So there are signs everywhere and aches and pains every day that remind me. And so I've started coming at it from a different angle as a patient rights advocate. Like I said, this doesn't mean that I'm against the medical professionals. We need you guys.
Right.
We need you guys. And this was an abusive surgeon. I believe that most professionals are working to help their patients.
Mm-hmm.
But when things go wrong, we need help.
Yeah.
Not silenced. We need help.
Right. There